Hi, my name is Kimberly Curtin. I'm the clinical pharmacist here at Men's Health Foundation. My professional journey began when I was a pharmacy resident at the VA in Palo Alto, and I got the opportunity to work with a preceptor who was working with HIV treatment. And after that pivotal moment in my life, I just knew that HIV treatment and the care for people living with HIV is where my heart was. After my residency, I began working in West Hollywood at one of the pioneering HIV pharmacies, and I had a unique opportunity to work with patients who were diagnosed with HIV in the 80s and the 90s. They went through a lot back then, a lot of medications and heart therapy, taking multiple pills a day and lots of side effects. It helped me grow as a person in terms of kindness and compassion. Kindness can foster trust and confidence, and you really need that when you're dealing with patients with HIV. They need to feel like they can trust you. And so instead of just being a dispensing pharmacist, I took that role a little further, and I was able to help them with adherence techniques. I connected them to care. I became part of their treatment. Dr. Tony Mills is the one that found me, and he brought me to Men's Health Foundation, and I couldn't be more happy to be part of this amazing organization. We're accredited as an HIV specialty pharmacy, which means that we actually have a patient management program where we have over 500 patients enrolled. We monitor them on a monthly basis in terms of their adherence, side effects, their health-related quality of life. It's really wonderful to be able to look back and know that I made an impact on patients' lives.
As the clinical pharmacist with Men's Health Foundation, Dr. Curtin designed the Patient Management Program for the agency's accredited specialty pharmacy. This program provides comprehensive medication review services and makes recommendations to healthcare providers based on evidence-based medicine and national guidelines to improve the quality and outcomes for HIV patients. Dr. Curtin carefully reviews monthly assessments of participants and will make additional contact when necessary to ensure the program is working in their favor. She works with patients' primary care providers to optimize their HIV treatment, initiates clinical interventions, and connects them with behavioral health services. Sarah.
Dr. Curtin's work and service for persons living with HIV has allowed her to not only connect with people who were diagnosed in the early 90s, but also see them live and thrive thanks to the medical advancements that are being made. Men's Health Foundation provides same-day PrEP and PEP services, HIV and STI testing and treatment, and medical care. For the lives of community members you continue to impact, the City of West Hollywood is proud to present Dr. Kimberly Curtin with the 2023 Paul Andrew Starke Warrior Award.
Hi everyone, we're so happy to be here. I stand here tonight with a heart full of gratitude as the recipient of this special award. When I was thinking about what I wanted to talk about tonight, so many things came flooding into my mind about my 25 years of work as a pharmacist specializing in HIV. I'd like to start by saying I'm a forever ally to the LGBTQ community, and I'm a clinical pharmacist who's made it my mission to contribute to ending the HIV epidemic. My introduction to HIV occurred during my pharmacy residency at the VA in Palo Alto, where my preceptor, who was deeply involved in the study of HIV treatment, entrusted me with a retrospective HIV treatment study. And since then, my dedication to individuals living with HIV has been unwavering. In 1999, I began my professional journey at one of West Hollywood's pioneering HIV pharmacies, a setting that allowed me to expand my expertise and engage with people who were diagnosed in the 80s and the 90s. This pharmacy, located on Santa Monica Boulevard, was opened in 1990 by a pharmacist named Loyd Tittle. By the early 90s, AIDS was the leading cause of death among Americans aged 25 to 44 and hit Los Angeles particularly hard. Customers would come into the pharmacy looking like they may not live for more than a few days. Loyd worked with organizations like Being Alive and APLA to inform customers about experimental treatments and organize lectures with doctors presenting the latest options. Unfortunately, Loyd was diagnosed with AIDS and passed away in 1993 at the age of 42. His sister Ruth moved to LA from Kentucky to care for Loyd during his final years. As Loyd lay close to death, his last words to his sister were, "Ruth, take care of the stores, and I love you." Ruth made it her mission to continue Loyd's vision for the pharmacy and became the CEO and owner, founding member of the foundation of the AIDS Monument, served as a board member of the West Hollywood Chamber of Commerce, and so many other impactful community services. This special person, Loyd Tittle, is the reason I'm here today. Not only did she nominate me for this award, she inspired and motivated me to help patients with the same level of advocacy and compassion that she gave. I will forever be grateful to her and to Loyd, who I sadly never had the chance to meet, but somehow I feel like I knew deeply. While working at this pharmacy, each face I met, each story I heard, became an indelible part of my soul. Each person carried a narrative that was both unique and universal. Patients would come into the pharmacy and know if they needed extra help with their medications or even a hug, I was there for them. I was privileged to be the first person to discuss HIV with some of those diagnosed way back then. Their stories are etched in my heart, a testament to the power of compassion in the face of adversity. As a pharmacist, not only would I dispense medications, but I was a patient advocate. One day in 1999, a man came into the pharmacy and introduced himself to me as Dr. Charles Farley. For those of you who have not heard of the late Dr. Farley, he was the medical director at AHF, and for me, it was like a star sighting because he was one of the most recognizable doctors in our field. And he came in to see me. He wanted to tell me that I helped someone close to him by devising special ways to help him remember to take his HIV medications. At this time, highly active antiretroviral therapy, also known as HAART, required patients to consume upwards to 20 pills a day, and this person was improving with my help. Dr. Farley invited me over to his house and we became buddies, and he inspired me to continue going above and beyond in our field. Shortly thereafter, one of my work friends started looking very thin and frail, and I asked him if he was okay. He opened his mouth and there was a huge tumor on his tongue, so painful that he was unable to eat. He was afraid to see a doctor because he lost his partner to AIDS due to AZT toxicity, and he did not want to incur the same fate. I called Dr. Farley and got my friend in for an appointment right away. With our encouragement, the encouragement from Dr. Farley and me, we started him on medications and the tumor gradually diminished and he was able to eat again. I then realized that my mission as a pharmacist transcended the conventional roles. The era of HAART in the late 90s, early 2000s came with its challenges, numerous side effects, and a significant pill burden. Not to mention the protease inhibitor Norvir that was only available in an oral solution. It tasted so horribly. Nobody wanted to take it, and we tried everything. Pre-coating the mouth with peanut butter, mixing with chocolate milk, just nothing helped. It was a very difficult time. Not only did I dispense medications, I recommended alternative therapies, conducted comprehensive medication reviews, offered adherence techniques, and formed genuine connections with patients, their spouses, and healthcare providers. Each patient became more than a case. They were individuals I knew and I cared about deeply. During this time in my life, I had the great pleasure to get to know a brilliant man named Dr. Anthony Mills, who is the reason I'm still doing the work I set out to do. Dr. Mills is the driving force and visionary leader behind Men's Health Foundation, where I began working in 2018. MHF connects people at risk to comprehensive health care. The MHF Pharmacy is a nonprofit accredited HIV specialty pharmacy, and like you already heard, we implemented a patient management program that supports hundreds of patients living with HIV. We also connect patients with healthcare providers, facilitate appointments, work with benefits and medical care coordination team, which address broader aspects of their lives, including housing, food, substance abuse, health, and finances. Our nonprofit pharmacy helps fund programs such as SoCal Club, a community center in South LA for LGBTQ youth of color ages 12 to 29. I'm so grateful to work with an amazing crew, intelligent and dedicated people at this wonderful organization. I talked about some of the low times and suffering I witnessed, but there were also some great joys and great successes as HIV medications improved. Over the years, my experience has evolved in tandem with the advancements in HIV treatment. The landscape has shifted, and today, most patients no longer endure the burden of multiple daily medications. We now have single tablet regimens and injectable HIV medications. No longer are the days of ingesting 20 pills leading to awful side effects. Those who were told they were not going to live were able to live long and fulfilling lives, and that needs to be celebrated. I want to give my deepest gratitude to the City of West Hollywood for this incredible honor, City Council and all city staff. I would like to thank Loyd Tittle and West Hollywood Mayor Pro Tem John Erickson for nominating me, Dr. Mills for creating MHF, the fantastic MHF pharmacy team. I see a lot of my team here tonight, thank you. The medical care coordination team, benefits, prep team, medical team, and all supporting staff. I would like to also thank the other Warrior Award recipients for their wonderful work, as well as my sweet parents and amazing sons for their love and support. I dedicate this award in honor of Loyd Tittle. Let's lead with love, kindness, and understanding as we work together to bring an end to the HIV epidemic.